when a patient asks me what DNS is, I break it down to it's a technique we do that helps the body function maybe more appropriately is a better term, less stress, helps it move better, easier, whether that's just through your day-to-day life, work, sports, whatever. It's pretty much all encompassing, and then you mix that with everything else we do. It's like the perfect combination of everything. Really, it's an amazing way to change function of how the body moves. That's DNS.
DNS is the ability to use the motor program that your brain prefers to use for a specific type of movement, whether it's in the shoulder, the hip, or the foot. It's the way we use the brain to use the right movement prep for muscle activation and for efficiency in the movement that we're looking for.
Okay, so I explain DNS to patients like this. So I'll say, no matter where you're born across the globe or here in the United States, we're born with a blueprint of developmental milestones, or a sequence, if you will. So at 3 months, we're supposed to be doing something, in 4 months, and we're supposed to be doing something else, and the progression builds. So that's our developmental sequence, or developmental kinesiology. So with our rehab, it's based off of that map or blueprint that we're all born with, and it's all ingrained in us. So that's how we rehab all of our patients, is taking that milestone to let's say stabilize the scapula for proper joint stability, for proper joint centration, and for the perfect muscle synergy.
Alright, so I explain DNS to patients pretty simplistically. So basically I just say that we're using positions that we've been in the first year of life to give us nowhere to hide when we're trying to work on areas that need greater co-activation of the muscles around that area. So whether that's the scapulothoracic joint, we're talking about things that maybe we're supporting distally, whether that's the diaphragm for low back patients, anything like that. I just always revert it back to there's the baby, and why we're doing this is because we have a perfect specimen here that everything is basically perfect in that first year of life we develop normally. And so taking them back to that first year of life is really important in rehab, because it kind of gives us a blueprint of what we should look for and what they should be doing.
The way we explain DNS to our patients here is we use the theme of the first year of development, and that being a critical time period where we basically return the patient back to those different key stages, and we use these positions, these support points, to teach the brain how to use muscles in a synergistic way. It's a little bit different than what traditional rehab approaches do, where we try to isolate one muscle. So we use the DNS positions that all of our patients have already been in their first year of life, and it's essentially kind of like hitting Control-Alt-Delete on a computer. And that's the analogy I always use with my patients is, if something's wrong with technology, we hit Control-Alt-Delete. If something's wrong in our body, we kind of do the same thing by returning to the same positions where we can teach them how to activate the right muscles.